Hi everyone, thanks for stopping by. My name is Stephanie. I'm a BSN RN. In this channel, I talk so much about nursing, beauty, hygiene, and lifestyle videos. If that is something you're very much interested, please do consider liking, sharing, and subscribing to this channel. Today's video is going to be common mistakes that we make as nurses and how to avoid them. The very first mistake I want to throw out there is that never become comfortable that you've written your license exam, you finished nursing school, and then you just feel like you know everything. There's so much to still learn. There's so much you can always grasp along your way, along your journey to being a nurse. There's so much experience that you still need to, tip your toes into, your skills, your knowledge base, medications, medical diagnoses. Make sure to be comfortable with asking people what you do not understand. Make sure to get comfortable with asking people what you do not know, because I can tell you that so many errors are made when people feel that they know and they don't need to ask people. So make sure you're getting comfortable in expressing yourself and say, hey, putting yourself out there and say, hey, I don't know what this is, can you explain it better to me? I kind of feel like it's better to approach the seniors and tell them, hey, I don't understand this, rather than you make a mistake just because you didn't want to ask. So don't get comfortable in thinking that you have now reached the territory or the zone where you know everything, because I can tell you what, the medical field is ever evolving. The second thing on my list that I want to say is never trust the previous nurses, their notes, their assessment. When you take your shift reports, the very first thing you should do is check those IVs. Check everything that the nurse said. If the nurse said the patient peed a lot, you want to check to see that the canister of the Foley is empty. You want to make sure that if for some reason the patient is having like a heparin drip that needs two nurses to co-sign to say that, okay, this is the number or the titrating figure that I handed report to, make sure you check those numbers. If for anything the patient is on a drip and you need to make sure that the blood pressure is actually within limits, just make sure that whatever the previous nurse told you is what you're actively seeing on the patient. Because I can tell you from my experience, there has been many times that I've gotten reports from another nurse, and the nurse said maybe the patient had 2 IVs, but it turns out the patient had maybe just 1 or didn't even have any. So make sure to always check what is actually on the patient. Another thing is never go for what the nurses or the previous nurses document. You want to make sure you do your own assessments. You want to make sure you lay your eyes on the patient. You want to make sure you're checking everything, because guess what, whatever you document is going to be the gospel truth. And if anything should happen to that patient and it is kind of contradictory to what you documented, guess who gets in trouble? You sure guessed right. The next thing I want to highlight is please read your clinical notes. I cannot even emphasize this enough. There's been so many times, let's say the doctors will put in a note for, okay, the patient needs so and so procedure, but because you did not read the doctor's note, you might go ahead and do something that might be contraindicating for that patient. Take for example, a patient is scheduled for a procedure that morning, or take for example, a patient is scheduled for dialysis that morning. If you had read the clinical note, you should have known that if that patient was due blood pressure medications that morning, it is going to be for you and also for the patient's safety to hold any blood pressure medication, because we all know that dialysis normally would tank a patient's blood pressure. So always remember to read clinical notes. Sometimes also read the previous nurse's note. You want to know what happened during that nurse's shift with that patient. So always read clinical notes from the doctors, maybe the physical therapist, dietitian, if the patient is diabetic, from the endocrinologist, maybe from the respiratory doctor. Always make sure that you're keeping yourself abreast with the note of the medical authority following those patients. The next mistake, I cannot even scream this enough, is please scan your medications. There's been several times that patients have gotten the wrong medicines, maybe because the medicines kind of sound familiar or look familiar to other medications. So there is also a reason why we have that safety precaution to scan medications that will tell you that, hey, the medication you're about to give the patient is wrong. So I will tell you, always scan your medications. I'm that one nurse that I pride myself in always scanning my medications, like always scanning my medication. If for any reason a medication cannot be scanned, it is up to you, and it's going to be up to your license safety to reach out to the pharmacy or pharmacist and tell them, hey, I'm trying to scan this medication, or maybe you've taken another one, it's still not scanning. You have to reach out to the pharmacist and ask them, hey, this particular medication is not scanning. Is there anything that you can do to, kind of sort out the issue? Many a times, sometimes they will send the medication, but with another generated barcode for you to scan in order for you to give that medication. So yeah, I always tell myself that, hey, I must scan my medications. It doesn't matter what it is, even something as small as Tylenol, something as small as Colace, something as normal as, even a thyroid medication. Please, for patient safety, always make sure you're scanning your medications. Another very common error is know what medications you're giving to the patient, know what the medications are for, and to an extent know the contraindications or the side effects of those medications. Take for example, a patient is normally on blood pressure medication. You want to know that hydralazine is a medication for blood pressure, because you want to also know that before giving that medication, you need to look out for the patient's, kind of vital signs. Also, another medication you might want to look out for is something like you want to make sure that you're watching the patient's heart rate. If there's something like digoxin, you want to always remember that this is a medication that has to be pushed very slowly, and you have to monitor the heart rate while you're pushing it. Also, you want to know that, hey, if this is a pain medicine, you want to first of all monitor the patient's blood pressure before giving that pain medicine, because pain medicines have been known to drop blood pressure. Also, medications that will be used to calm patients like lorazepam, those medications also will affect blood pressure. So you want to know that their vital signs are stable before you're giving those kind of medications. So it's very important to know what the medications you're giving to the patient are for, and you want to know what the medications do to the patient, as well as the side effects of the medications to that particular patient. We all know that nursing can be very draining. Nursing burnout is real. If you feel like there's so much for you to do with so much little time that you cannot catch up, please always make sure you ask for help. Please. There are nurses out there who will help you. If you feel like everybody is very busy, everybody is swamped, there's no one around, make sure to reach out to the charge nurse. You can even ask your CNAs if it's something that you feel that they can take, like vital signs, or like just dropping into the patient's room just to throw their eyes on the patient and see that the patient is fine, the patient is comfortable. Always make sure to ask for help. We are in a profession where we rely on others for us to fully do our jobs properly. Another thing is when you tend to do everything by yourself, especially if it is a very hectic day for you, you're going to go home very tired, very exhausting. And even within the day, especially if the day started very heavy for you, let's say for example you actually called a code on one of your patients, and it's a very demanding patient, and then there's another high acuity patient, you would kind of want to reach out to your charge nurse and be like, hey, I might need you to help me with this and this, maybe some pain medication which is due, or please give the patient this, or please make sure that the patient eats before something effectively takes place. So always make sure that you're asking for help when you're too swamped with so much to do with your other patients. The next thing I want to say is this. I know we all went through nursing school, and this was repeated over and over. It was echoed. If you did not chart it, pretend it never happened. Please make sure you're charting every single thing you do. If you change the patient's wound, if you change an ostomy bag, if you empty the Foley, if you changed an IV, if you suction the trach of a patient, every single thing you're doing for a patient, please document it. Another thing too, another very common thing that we nurses kind of ignore is when you turn the site of a patient. Let's say for patients who are developing pressure ulcers, you want to make sure that every time you turn the patient, you're actually documenting it, because guess what, if that patient should get any pressure ulcers, or if the current existing pressure ulcers should get worse, guess who is going to be liable to that? It is you, the nurse, because you didn't do your job. But when you document it, it tells everyone in the care team that, hey, this patient was actually turned every now and then according to the care plan. I cannot stress this enough, but reporting a patient's changing condition is very critical. In as much as some things might look like they are very minute, you never know how the outcome or the consequences of it might end. If you feel like when you got a report for a patient, the patient's normal respiratory rate was, let's say, in the 16s, and for some reason the patient's respiratory rate is now maybe 10 or 11 and sustaining, it is up to your place as a nurse to reach out to the doctor, to reach out to the respiratory nurse, to the respiratory therapist, and be like, hey, I feel like something is off. The patient is deviating from their normal. This patient from their past vital signs has always been this, but this is just a sudden change. And you also want to make sure that you're monitoring the numbers. You want to really look back to like maybe 2-3 days to see how their vital signs have been. If for any reason the patient's blood pressure is just a sudden drop, you want to make sure you check that patient and be like, hey, are you feeling dizzy? Do you feel like your head is spinning? Are you feeling any headaches? Kind of assess the patient. And if it's something that maybe turning them or letting them just move a little bit in bed to bump up that blood pressure, then it should be okay. But if after you've done all these things and there is still no drastic improvement or change, it is up to you to reach out to the doctor, to the charge nurse, or to whichever department in concerned, let's say the respiratory doctor or the neurologist, and make them aware so that they can intervene appropriately. We are supposed to be our patient's advocate, and please let us do a better job at doing so for our patients. When you get into the patient's room, please take your time with the patient. I cannot tell you how many times some nurses have made mistakes, let's say in an event where they were giving medications. Normally, sometimes there are some medications that don't need to be crushed, but because we are hurrying to go attend to another patient, we go ahead and crush these medications. In my opinion, I want to stress that whenever you get into the patient's room, please take your time. Make sure you take your time to do everything. Read the notes of those medications and how the medications have been helping or improving the patient. You also want to communicate to the patient. You want to ask the patient questions. Let's say the patient has a medication which is a stool softener. You want to actively ask the patient, hey, do you still feel constipated? When lastly did you poop? Or if it's a medication that should boost their appetite, you want to actively ask them like, hey, when breakfast came around, did you finish everything on your tray? Because there's no need for you to keep giving a medication which would be of no help to the patient. So when you get into the patient's room, if the patient for some reason cannot speak, maybe they were an elderly patient, it's up to you to even ask the family and be like, hey, what do you know about the patient? Has the patient pooped? Does the patient eat very well? Has the patient been complaining about any pain? Take your time when you're in the patient's room. Give the patient's medication, document the right thing, and I can tell you that this will make you to avoid so many mistakes that can come back at you. Look, I don't know about you, but I'm that nurse that if I have to do a certain procedure for a patient, let's say inserting a Foley, or let's say starting a feeding pump, I like to always make sure that everything I need for that procedure I have before I walk into the room. It is not fun when you're, let's say, maybe doing another procedure like changing a patient's wound, and you are actively, wearing your sterile gloves, and then all of a sudden you remember that, hey, you forgot to bring like a Q-tip, or maybe you forgot to bring like your 4x4 gauze, or maybe tape to cover the wound, it's not going to look professional on your part to the patient when you have to like leave in the middle of a sterile procedure and walk out just to go get something. So in my opinion, before you go into a patient's room to do any procedure, whatever it is, starting an IV, starting an IV medication, crushing a medication, anything of that sort, always make sure that you have everything you're going to need to administer or to complete whatever task you have to do for that patient. And on that note, I hope that this video was helpful to remind you and to let you know that there's some little things that we as nurses we do that can jeopardize the safety of our patients. Please always remember that your patient's safety is your priority, and avoiding these mistakes can actually save their lives. If you love this video, thank you so much for staying right up to the end. I would indulge that you please like, share, and subscribe to the channel. And from me to you, I'm going to say take care, and I'll see you in my next one. Bye guys.